Hi, this topic is about hypovolemia shock. First of all, we have to include definition. In definition, we can say in physiology and medicine, hypovolemia is a state of decreased blood volume, more specifically, decrease in volume of blood plasma. It is thus the intravascular component of volume contractions or loss of blood volume due to things such as hemorrhaging or dehydration, but it also is the most essential one. Hypovolemia and volume contractions are sometimes used synonymous. Another definition that we can include is hypovolemia is characterized by salt sodium depletion and thus differs from dehydration, which is defined as excessive loss of blood, of water.
Our next topic is hypo, H-Y-P-O, volemia. And this condition relates to the absence of adequate fluids in the body. So you get a whole different picture of the patient here. The patient tends to be quite drawn, thin from their normal appearance. And their overall cognitive perceptual status involves a lot of confusion. Makes you a bit disoriented to be out of fluids. People become quite thirsty. And in terms of their heart assessment, there's a very rapid, thready pulse described as tachy for tachycardia. And the blood pressure is low. The patient's skin turgor and actual palpation of the skin reveals very warm, dry skin with decreased resilience, and their muscles show signs of weakness, and the patients often experience cramping. So what's a nurse to do? Well, treatment often involves treating the cause of the volume loss, correcting the cause of excessive urination, or treating diarrhea or vomiting, and providing rehydration through oral fluids or the use of isotonic IV fluids. Frequent oral care because of the dry, irritated mucous membranes in the mouth, and attention to skin care to avoid any kind of breakdown are also important. I&O monitoring, vital sign assessment are also, as always, important to do.
Carry on with this exposition, we can say something about the causes. Common causes of hypovolemia are loss of blood, external or internal bleeding or blood donation, loss of plasma, severe burns and lesions discharging fluid, loss of body sodium and consequent intravascular water, example diarrhea or vomiting, vasodilatation that includes involving widening of blood vessels such as trauma leading to dysfunction or nerve activity on blood vessels and inhibition of the vasomotor center in the brain, or drugs such as vasodilators typically used to treat hypersensitive individuals. In the diagnosis, we can include that clinical symptoms may not be present until 10 or 20% of total whole blood volume is lost. Hypovolemia can be recognized by tachycardia, diminished blood pressure, and the absence of perfusion as assessed by skin signs, skin turning pale and or capillary refill or on forehead, lips and nail beds. The patient may feel dizzy, faint, nauseated, or very thirsty. These things are also characteristic of most type of shock.
Shock, or hypoperfusion, is the inability of the circulatory system to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time. Decompensated shock starts with low blood volume or lack of perfusion. Symptoms include falling blood pressure. Shock is irreversible when perfusion to the organs cannot be restored. Cell damage occurs, especially in the liver and kidneys. Even if vital signs are restored, irreparably damaged organs may cause death. The main types of shock are hypovolemic shock, caused by uncontrolled hemorrhage, internal, external, or both, or by plasma loss in burns or crush injuries. Cardiogenic shock occurs during a myocardial infarction or heart attack. Damaged heart muscle or electrical malfunctioning decrease the strength of the heart's contractions, causing a slow, fast, or irregular heartbeat. Neurogenic shock may result from the uncontrolled dilation of blood vessels due to nerve paralysis in spinal cord injuries. There is no blood loss, but the blood vessel dilation increases the capacity of the circulatory system, and available blood can no longer fill it. Sepsis, massive infection, or an anaphylactic or severe allergic reaction may also cause shock from blood vessel dilation. As an EMTB, you do not need to diagnose the type of shock. Instead, you must recognize and treat for shock whenever there is a mechanism of injury or signs that indicate the possibility of shock.
Okay, carry on with this exposition. We can say the stage of hypovolemic shock usually refers to as class of shock. Most sources state that there are four stages of a hypovolemic shock. In the stage 1, we can include up to 50% blood volume loss, that includes 750 milliliters, compensated by constriction of vascular bed, blood pressure maintained, normal respiratory rate 12 to 20 breaths per minute, pallor of the skin, normal mental status to slight anxiety, normal capillary refill, less than 3 seconds, and a normal urine output. In the stage 2, we can include that 50 and 30% of blood volume loss is more than the stage 1. Cardiac output cannot be maintained by arterial constriction. Tachycardia is increased by 100 beats per minute. Increased respiratory rate, more than 20 respirations per minute. Systolic blood pressure maintained. Increased diastolic blood pressure. Narrow pulse pressure, gap between the systolic and the diastolic pressure. Pale, cold, and clammy skin as blood flow is directed away to major organs such as the heart, lungs, and brains. Mildy, anxious, restless. Delayed capillary refill, and for last, the urine output of 20 and 30 milliliters per hour. Okay, including all of this, we can go around to stage 3. 30 to 40% blood volume loss, about 1,500 to 2,000 milliliters. Systolic beat falls to 100 millimeters per mercury or less. Classic signs of hypovolemic shock: marked tachycardia, increased heart rate, mile per 120 beats per minute; marked tachypnea, increased rate of respiration, more than 30 respirations per minute; alterations in mental status, confusion, anxiety, and agitation; sweating with cold; pale skin; delayed capillary refill; urine output of approximately 20 millimeters per hour. And finally, in this stage, we have the stage 4. In the stage 4, we can include loss greater than 40% of the blood, Meyer of 2000 milliliters, extreme tachycardia with weak pulse, pronounced tachypnea, significantly decreased systolic blood pressure of 70 millimeters mercury or less, decreased level of consciousness, lethargy, coma. Skin is sweaty, cool, and extremely pale. And the two symptoms of this stage 4 can include absent capillary refill and negligible urine output. In this video, we can include the correct position to attend this patient.
Shock is a life-threatening condition and occurs when the blood flow to vital organs is critically reduced and deprives the organ of oxygen. It is simply described as the lack of oxygenated blood to the body's vital organs. Major causes of shock include heart attack, severe blood loss from uncontrolled internal or external bleeding, and also conditions known as dehydration, severe infection, poisons, persistent vomiting, and diarrhea. The recognition, signs, and symptoms: a rapid, weak pulse, pale, blue-grey, cold, clammy skin, nausea and thirst, rapid, shallow breathing, unconsciousness. Let's now look at the treatment.
First of all, it is important to treat the cause, whether that is a bleed, a burn, or an injury. If the injuries allow, lay the casualty down and then raise and support their legs. This action will help keep the blood at the body's vital organs. Be aware of injuries such as a spinal injury or an injury to the legs. So if, for example, a casualty has a fracture to one leg, then to treat for medical shock, you should raise simply the other leg. You should loosen tight clothing, keep the casualty warm, with items such as blankets or coats, but ensure that you insulate any cold ground. Call 999, calm and reassure your casualty, whilst monitoring the airway and breathing at all times. If the casualty becomes unresponsive and unconscious and is not breathing normally, then you should carry out the procedure for basic life support.
So, in summary, shock is life-threatening. Don't forget to treat for shock when managing more obvious injuries. Lay the casualty down and raise their legs if injuries allow. Dial 999.
Well, the end of this exposition, we can include the treatment. The treatment includes oral fluids that include moderate sugars and electrolytes, or needed to replenish delayed sodium ions. Furthermore, the advice for the donor is to eat good solid meals with proteins for the next few days. Typically, this would involve a fluid volume of less than 1 liter, although this is highly dependent on body weight. Larger people can tolerate slightly more blood loss than smaller people. The first step that we can include is that external bleeding should be controlled by direct pressure. If direct pressure fails, a tourniquet should be used in the case of severe hemorrhage that not cause that cannot cause but they be controlled by direct pressure. Tourniquet use in civilian first aid is now advocated as part of the CABC approach. Other techniques such as elevation and pressure points are not always effective but should still be attempted. As a rule of thumb, anywhere you can feel a pulse can be used as a pressure point to stop bleeding with the obvious exception of the carotid pulse. If a first aid provider recognizes internal bleeding, the life-saving measures to take is to immediately to call emergency assistance. Thank you.